Hello, everybody, people coming in. So we'll give it a few minutes until people are really in the call, in the webinar, and then we'll start introducing the speaker and the series. What I can already do as people are coming in, I can already introduce myself, and later we'll introduce Chris Leatherby and Riccardo. So I am Henrik Jungabele, the founder and the director of the Mind Foundation, which is a European international organization. And we are a research and education organization, also involved in clinical research, but like basic research, building questionnaires and asking questions, bringing disciplines together. That's one of the things that are very high on the top of our agenda. And that's what we actually do with the philosophy series. So the philosophy series is trying to bring in knowledge and critical questions from philosophy into a field that is transdisciplinary by itself, but philosophy has not had the position and the standing in the last decades that we wish it to have. So, and that's when we came up with the idea of asking a philosopher in the field to curate a series that touches on several important questions from the viewpoint of philosophy in the field. And that was Chris Leatherby, who we asked, and Chris is here in the meeting. And Chris, would you expand a little bit on how the topics or the speakers were assembled, how the process was, and then introduce, of course, the speaker. Welcome, Chris. Welcome, Riccardo.
Sure. Thanks very much, Henrik. And I'd like to thank the Mind Foundation for inviting me to curate this series. It's a really great privilege to do so. And I think the idea for the series, which is not something I can take credit for, is a really excellent idea. So the way we've chosen the topics that we have is basically, it's a combination of two things. It's looking at the main themes that have already emerged in the sort of burgeoning academic literature on philosophy and psychedelics in the last 10 years or so, because it's always been noted, you know, as long as psychedelics have been discussed academically, that they raise many philosophical questions, and yet it's only been in recent times that they've received a lot of detailed and sustained attention from people whose primary training and disciplinary orientation is academic philosophy. So in the past decade or so, we've seen a few distinctive areas of interest start to emerge, you know, discussions in the philosophy of mind, discussions in epistemology, and so on. And then there are some other topics that haven't received that much attention in the scholarly literature yet, but that are repeatedly getting raised in perhaps non-philosophical publications, or are sort of obviously coming over the horizon as new areas of interest for philosophy and psychedelics. And tonight's topic, which is psychedelic phenomenology, is a bit like that in a way, because a lot of attention has been paid to the phenomenology of the psychedelic experience in the broad sense of phenomenology, in the sense of what the experience is like, but less has been done, though a little bit is starting to emerge in the last few years, but less has been done to date, actually looking at how phenomenology as a specific philosophical methodology, the phenomenological tradition in philosophy, might inform and assist and aid our understanding of the psychedelic experience, and indeed of its therapeutic import, which is something that Riccardo has taken a particular interest in. So at that point, I'm going to switch to talking about Riccardo. So this is tonight's topic and how it fits into the broader mission of the series. And I should say as well that part of what we want to do with the series is to give an opportunity for people in the psychedelic world, you know, psychedelic researchers and interested parties, to learn a bit about philosophy and what philosophy can bring to our understanding of psychedelics. And on the other hand, to let philosophers who might not know that much about psychedelics to learn about the philosophical issues that arise in thinking about psychedelics and their therapeutic use. We really want to bring psychedelics to the philosophers and bring philosophy to the psychedelicists, and hopefully kickstart some sort of fruitful exchange. So tonight we're very fortunate.
Chris, before you introduce Riccardo, so one question before to really get it started. So one of the missions of the Mind Foundation is to let's call it de-exceptionalize psychedelic therapy and psychedelic experience where it is, let's say, wrongfully exceptional, presenting itself as exceptional. Will we add to that that mission of the Mind Foundation with the philosophy series, or will we make it more exceptional?
Oh, I mean, I don't want to be controversial, Henrik. I'm actually an unrepentant psychedelic exceptionalist. I think psychedelics are exceptional and psychedelic therapy is exceptional. Maybe not in all the ways and to all the extents that people sometimes think. And I think probably in general, we do agree on a lot here. But I don't know. I mean, some drugs and some therapies have to be exceptional. Why shouldn't it be these ones and this one?
Let's argue about it later. So
let's argue about it later. So for now, I will introduce, without any further ado, our speaker tonight, whom we're very fortunate to have, Riccardo Miceli McMilan, who is a junior doctor and bioethicist based in Brisbane in Australia. Riccardo's research involves investigating psychedelic-induced changes in subjectivity by drawing on the field of philosophical phenomenology and in particular phenomenological psychopathology. And he's already published several papers on topics such as psychedelics and phenomenology, as well as the bioethics of psychedelic therapy and related matters. His work on psychedelic phenomenology aims to inform other areas of investigation, such as causal mechanisms of psychedelic therapy, the nature of key concepts in phenomenological psychopathology, and ethical considerations for the use of psychedelics in medical contexts. So over to you, Riccardo.
Thank you very much, Chris, Henrik, and everyone from the Mind Foundation for putting together this fantastic series, and it's a complete honor to be here as part of this series. I'm just going to pull up my screen, if that's all right. Oh, am I able to put up my screen? If that's all right, Henrik?
You should be.
It says it's disabled participant screen sharing.
You should now be a co-host.
Yeah, fantastic. Thank you. So, can everyone see that?
Yes.
Fantastic. So yes, today's talk is on sort of psychedelics and phenomenology more broadly. As Chris said, sort of my background is in the sort of medicine and the sort of bioethics of psychedelic experiences and how sort of phenomenology might inform some of the ethical considerations of sort of psychedelic medicalization. I just wanted to flag before we jump into it today, I'm very happy to sort of be contacted sort of down the line if anyone's got any questions about the sort of talk tonight. It sometimes takes some time to think of questions, or we might not feel sort of comfortable sort of speaking in a live format. So please feel free to shoot me an email afterwards and we can discuss anything further. So today's talk will be sort of split into 4 different parts. In part 1, we'll sort of go through a bit of an introduction to what phenomenology is. Here, we'll discuss a bit about sort of what defines phenomenology, as well as some of the challenges in defining phenomenology. And we'll also talk about some of the key concepts that phenomenologists sort of use when in their sort of phenomenological analyses. In part 2, we'll switch gears a little bit. And here we'll talk a bit about how phenomenology has been applied. In particular, we'll look at how phenomenology has been applied to sort of unpack and explore experiences that arise in the medical context, such as experiences of illness, and particularly experiences of mental illness. In part 3, we'll sort of turn our gaze back towards psychedelics, and we'll look at some of the existing phenomenological work that exists on unpacking the psychedelic experience. We'll sort of take a bit of a look at sort of how different concepts or different structures of consciousness, as they're called, have been applied to understand the psychedelic experience. And we'll also sort of take a bit of a dive into how these sort of different applications of a phenomenological dissection of the acute psychedelic experience might help explain some of the causal effects of psychedelic-assisted psychotherapy. In part 4, we'll sort of turn our gaze towards the future. And here we'll sort of discuss a bit about sort of what might lie ahead for the field of psychedelic phenomenology, as well as what implications such a field has on both the field of phenomenology and the field of psychedelic science. Righty, so let's get cracking. Part 1, an introduction to phenomenology. So what is phenomenology? So look, in sort of true philosophical spirits, no matter how you end up trying to sort of define phenomenology, you will inevitably end up infuriating or annoying a whole bunch of people that call themselves phenomenologists. And there's a sort of key series of definitional challenges sort of as to why this is the case. And I think it's important to understand some of the contextual background and sort of difficulties in defining phenomenology, as phenomenology is in part defined by its redefinitions across history. And so understanding some of the challenges and pinning down a definition of phenomenology is, in its own way, a first step in defining phenomenology. One of the key definitional challenges when it comes to sort of pinning down phenomenology into a singular definition is that phenomenology is often conceptualized in sort of two quite radically distinct ways. Now, on the one hand, phenomenology is often conceptualized as a historical movement in philosophy. And by this account, phenomenology is thought to be a sort of series of different philosophers and their works, and tracing the lineage of how philosopher A influenced philosopher B and how philosopher B influenced philosopher C is what phenomenology is. It's this lineage of different philosophers and how their works intersected. By this account, you'll come across introductory books to phenomenology, a bit like de Moran's Introduction to Phenomenology, that'll take you through philosophers like Edmund Husserl, Martin Heidegger, Maurice Merleau-Ponty, Jean-Paul Sartre, and so on and so on. Now, on the other hand, phenomenology is often conceptualized as its own distinctive branch of philosophy. So a bit like epistemology is the branch of philosophy that deals with questions regarding the nature of knowledge, and ontology is a sort of branch of philosophy that deals with the questions relating to the nature of being. Phenomenology is thought to be its own particular branch of philosophy with its own focus of inquiry. Now, what that focus of inquiry is can depend on who you ask. And this is where we sort of get to another challenge of defining phenomenology, and that's the challenge of the phenomenologies. At the end of the day, most definitions of phenomenology involve some kind of philosophical investigation of subjective experience. But depending which philosopher you ask or which part of the tradition you consult with, how exactly phenomenology engages with subjective experience can look quite different. To muddy the waters even further, perhaps particularly for those of us that might be approaching phenomenology from the sort of way it's been applied in the cognitive sciences and other empirical sciences like psychological sciences, the term phenomenology in this kind of empirical context is often thrown around rather loosely. And it's sort of meant to denote any kind of investigation of subjective experience at all. And this is where we get another distinction that's called the capital P versus little p phenomenology distinction. So little p phenomenology refers to any sort of inquiry or investigation into the nature of a particular kind of experiences, while capital P phenomenology involves a particular kind of philosophical investigation into subjective experience. And so whilst these two endeavors aren't mutually exclusive, capital P phenomenologists will often state that what they do goes above and beyond little p phenomenology work. And I've included this painting here by MC Escher entitled Relativity, because I think it quite nicely encapsulates some of the definitional challenges of phenomenology. Depending what part of the history of phenomenology you enter the tradition from, depending which philosopher you enter the tradition through, your orientation as to what phenomenology is can often look quite radically different and can be quite disorienting. Nonetheless, I think if we take a bit of a step back and we take a bit of a look at the sort of general picture of phenomenology, some general unifying themes do emerge between all these different endeavors that have been called phenomenology. So, is there a definition that can pin down the unifying themes of all these different endeavors called phenomenology? Well, there's a very popular definition at the moment. It's one you'll find in the Stanford Encyclopedia of Philosophy online, as well as almost every introductory book to phenomenology at the moment. It's not universally accepted by any means, but it's the one we'll use for our purposes today, as it's so widely used at the moment in the sort of scholarship on phenomenology. By this account, phenomenology is the study of the structures of consciousness as experienced from the first-person point of view. I'll just say that again. Phenomenology is the study of the structures of consciousness as experienced from the first-person point of view. Now, at this point, you might be going, Rick, you haven't clarified anything. I mean, if anything, you've made things far more confusing, and you've introduced this new piece of jargon, the structures of consciousness. I mean, it's a fantastic term, but what on earth do we mean by that? And so quite quickly, we see that phenomenology is a field filled with jargon. So right from the get-go, you come across terms that are sort of used in very particular ways and can make the field quite inaccessible. Now, this particular piece of jargon, I think it's quite important that we unpack it just a little bit more, Because I think I'm confident once we've unpacked this term, the structures of consciousness, we'll sort of understand what this definition sort of entails a bit more, and we can move on to sort of going through some of the key concepts that phenomenologists actually talk about. And look, in order to try and unpack this term, the structures of consciousness, a bit more, I'm going to draw on a short excerpt from Sean Gallagher's book, Phenomenology. I think this is a fantastic book that sort of does a great job at sort of making phenomenology and a lot of its jargon very accessible to sort of novices to the field. And so I don't think I can do a better job than Gallagher here. So I'm just going to read a very short excerpt from his book that unpacks this term, the structures of consciousness. So Sean Gallagher explains the concept of the structures of consciousness by drawing an analogy to a window. He says, think of it this way. Consciousness is like our window onto the world. Of course, we are usually interested in the things we perceive through that window. Maybe we are fascinated with the stuff that we find around us, but how do we know that we are getting a good view through our window? For example, what if the window is dirty or colored or distorted? What if the window is designed? What if the way the window is designed or the window frame keeps us from seeing everything we want to see? The phenomenologists suggest that before we study the things that we see when we look outside the window, we should first be concerned about the condition of the window itself, whether it's dirty, colored, distorted, or structured in such a way that gives us only poor access to the object on the other side of it. Returning from the metaphor, the phenomenologist thinks that the first step in understanding the basis for knowledge is to study the conditions imposed by consciousness, and specifically the structural features of consciousness, the way it works, and perhaps the systematic distortions that might bias it. So what sort of Gallagher's getting at here is that these properties of the window sort of shape the way the world manifests through it. And our consciousness is a bit like this window. When we look through it, there are certain features of this medium through which we access the world, consciousness. And these different features invariably shape how the world manifests to us. And so phenomenology is the study of the structures of consciousness. It's the study of these properties of the window and how looking through the window changes and shapes the world. If the window is yellow, the world might take on a yellow tinge. And so phenomenology involves this sort of analysis of these different properties and these different structures of consciousness. So I hope that makes the definition make a little bit more sense. And we'll sort of talk a bit now about what some of these key structures of consciousness are that phenomenologists often talk about. One of the very first structures of consciousness you'll come across when opening any book on phenomenology is this concept of intentionality. Again, here we come across some more jargon in the phenomenological field. And when approaching the term intentionality, I think it's very important to divorce it from how the word is usually employed in everyday English. Intentionality, by this account, refers to a very particular relationship between our experience and the world. Intentionality refers to the fact that consciousness is always consciousness of something, according to the phenomenologists. Whenever we engage in a particular act of consciousness, there's always a content relating to it. So for example, if I think, I always think about something. If I see, I always see particular things. I can't just engage in sight without there being something which I'm seeing. So for example, if I look at this book, I can be conscious of this book in many different kinds of ways. Okay? I can be conscious of it by directly perceiving it. Okay? I can be conscious of it by critiquing it or judging it. I can be conscious of it by remembering it or anticipating it. Maybe I'm reading it a lot before bed, and when I go to sleep, I can be conscious of it by dreaming about it. This is all to say that intentionality states that consciousness is always consciousness of something, and the ways in which we can be conscious of the world are many. And it's the job of the phenomenologist to describe the different kinds of ways we can be conscious of the world and how these different modes of intentionality, if you will, relate to each other and how they might differ. How is perceiving the book different to dreaming about it, for example? These are the kind of questions that the phenomenologist might ask himself. Now, another and related structure of consciousness that phenomenologists talk about quite often is this concept of the pre-intentional states, also known as moods, attunements, or existential feelings, depending which part of literature you consult with. Now, pre-intentional states refer to the fact that at any one point in time, the kind of ways that you can be conscious of the world are limited. So at different points of time, you have access to different modes of intentionality, where you have access to different ways of being conscious of the world. And so just to bring it back to a concrete example, because I appreciate that a lot of these concepts can be quite obscure. So let's say I go back to looking at this book again now. I can be conscious of the book in many different ways. I can perceive it right now. I can judge it. I can remember it. I can anticipate it. But no matter how hard I try right now, I can't dream about the book. It's a mode, it's a sort of form of intentionality that I just don't have access to at this point in time. Pre-intentional states try and get at this idea that at different points in time, different ways of being conscious of the world are available to us, and some aren't. And trying to sort of pin down the different kinds of patterns of these available intentionalities is what's sort of encapsulated by this term pre-intentional states. Okay. Now, another topic that phenomenologists sort of talk a lot about, particularly those that work in the field of medicine, is embodiment. Now, embodiment relates to the fact of a particularly self-evident fact about our experience, and that is that our experience is spatially located. Our subjectivity arises from a particular point in space. And that point in space is very fundamentally related to our material form, or our body. So our subjectivity and our experience of the world is very closely linked and related to our material structure. What it's like to experience the world as a bat is undoubtedly very different as to what it's like to experience the world as a human. And it's quite interesting, the way phenomenologists carve up embodiments is often by making this distinction between noematic versus noetic embodiment, otherwise termed the difference between the object body and the lived body. And what phenomenologists are sort of getting at here is that there's two different ways in which we can experience our body. On the one hand, we can experience it in a noematic sense, or as an object of our experience. So for example, let's say you bring up your hand towards your face and you look at your hand. In this instance, you become aware of your hand as an object of experience. It's something which exists out there in the world as an object. It's out there, it's something which sort of is an object of your experience. Now, let's say I ask you to sort of feel the seat that you're sitting on, and you use your hand to sort of explore the texture of the seat. What you might find now is, as sort of time goes on, you sort of explore the texture of the seat in more and more detail. Your experience of your body shifts from that of being an object of awareness to the hand sort of disappearing and the world appearing more and more. And what happens there is, as the world appears more and more, you become more and more engrossed in the texture of the seat. You're still experiencing your hand, but not as an object of perception, but rather you're experiencing the hand through the world that it's manifesting to you, namely the seat. So just another example of this, because again, it's another quite obscure concept. Let's say, for example, you sort of, let's use our eyes as an example here. In day-to-day life, most of the time, sort of we won't be aware of our eyes as existing as objects in the world, but we are aware of, namely, the world at which our eyes manifest, namely the visual experience. The fact that you can see the computer in front of you, the chair underneath you. These are all ways in which you're experiencing your eyes. You're just experiencing them through the world they're manifesting, not as objects into themselves. Now, let's say you're walking along and a bit of dirt flicks into your eye and you start to itch it and it becomes a bit painful and sore. Now your awareness of your eye switches again towards being more noematic. It switches towards you experiencing your eye as an object of awareness again. It's something which exists in the world. Now, another structure of consciousness that phenomenologists talk a lot about, and particularly it's started to feature quite a bit in some of the literature on psychedelic experiences, is the structure of consciousness of selfhood. That is, that our experience has a sense of unity and ownership to it. And there are many different ways in which phenomenologists and other philosophers have carved up this notion of selfhood. One of the sort of big ways that have sort of been featuring in psychedelic literature at the moment is this distinction between minimal selfhood and narrative selfhood. So minimal selfhood refers to this pre-reflective sense of ownership over our experience. We understand that when we experience something, it is us, it is I that is experiencing it. Everything we experience has a certain quality of for me-ness regarding it. So for example, when I pinch my hand like this, I'm aware that the sensation that arises is something which is happening to me. It's not happening to you. It's not happening to my neighbor. When I pinch my skin and that sensation arises, I'm aware that it belongs to me, that experience. It's happening to me. Interestingly, phenomenologists that have worked in the space of psychopathology, particularly with psychotic spectrum disorders, have talked a lot about sort of disturbances in the minimal selfhood. So in schizophrenia and other psychotic spectrum illnesses, there's this group of symptoms known as thought alienation. These are experiences where patients feel either their thoughts are being pulled out of their head, their thoughts are being put into their head, or that they can broadcast their thoughts to other people. Interestingly, phenomenologists have argued that it's a disturbance in this pre-reflective sense of ownership over experience, or the minimal selfhood, that seems to be involved in underlying these altered experiences of self that underlie schizophrenia spectrum illnesses. Now, on the other hand, narrative selfhood refers to a bit more of a complex sort of sense of self and identity that revolves around the kind of stories we tell ourselves about who we are. It involves the sort of stories about past and how we understand our past, our present, and our future, and how we tie together our identity through the narratives of who we are. Now, there are several other sort of structures of consciousness that are mentioned in phenomenological literature, such as temporality, intersubjectivity, and several more. For the sort of interest of time and sort of our discussions here today, I'm just going to bracket them for now and sort of keep going with the discussion of phenomenology. So we've had a bit of a chat about what phenomenology is. One of the definitions for it, namely, it's the study of the structures of consciousness as we experience them from the first-person point of view. We've then gone through some of these structures of consciousness that phenomenologists talk about. We've examined intentionality, pre-intentionality, embodiment, selfhood. We've touched on temporality, intersubjectivity. Now, let's switch gears a little bit and see how phenomenology has been used to try to understand and describe particular kinds of experiences that arise, and in particular, experiences that arise in the medical context. Look, one of the very interesting ways, at least I think, that phenomenology has been used in recent years is to try and really nail down what it's like to be ill, or the phenomenology of illness. And so phenomenologists here will ask themselves, well, how do the structures of consciousness change in experiences that we call illness? Or to use Gallagher's example, what happens to the properties of the window when we're ill? Or what is it like to look through an ill window? And here there's been quite a bit of work. There's been some work by Drew Leder, Harvey Correll, Kevin Aho, Frederick Svenaeus. And for our purposes, we'll touch on a bit of the work of Frederick Svenaeus, as it'll feature again when we talk about psychedelic experiences. So Svenaeus tries to sort of answer this question of how do the structures of consciousness change in experiences we call illness? And immediately he's confronted with a bit of a problem. He notices that many things we call illness, there's many things we call illness, and they're often quite different. And so what, if anything, could be said to tie together the experience of appendicitis with that of schizophrenia, for example? Likewise, the very same disease process can lead to very different experiences of illness. So for example, if I'm a professional typist, getting carpal tunnel syndrome and losing sort of function of my hand would be experienced very differently than if I was a singer. Nonetheless, Svenaeus thinks he can sort of find a unifying feature that ties together all these different experiences we call illness. And then namely, he says, well, there seems to be some form of suffering that's involved in all things we call illness. And suffering, according to Svenaeus, involves a particular change in pre-intentional state. It involves a change in the kinds of intentionality that we have access to at a particular point in time. And the particular change in intentionality that happens, according to Svenaeus, is a change that leads the kinds of ways we can be conscious of the world being alienating, or leading to us feeling unhomelike in our existence. And to use Svenaeus's language here, he states that suffering, and by proxy illness, is an alienating pre-intentional state, overcoming a person and engaging her in an embodied struggle to remain at home in the face of the loss of meaning and purpose in life. It involves painful experiences at different levels of the person's being in the world that hang together through the suffering mood, but nevertheless distinguishable by being primarily about embodiment, intersubjectivity or others, and selfhood, particularly narrative selfhood. So this is all a lot of sort of technical language and sort of detailed explanation to sort of get at the point that what Svenaeus is saying here is that when we look at applying phenomenology to the experience of illness, we see that illness and the experience of illness involves a particular shift in pre-intentional state. And it's a particular pre-intentional state that means the only kinds of experiences we have access to, or the only kinds of ways we can be conscious of when we're ill, lead us feeling alienated and unhomelike in our world. And that alienation can be traced to sort of different parts of our experience. It can be traced back to his embodiment, he argues, and he terms that illness suffering. That alienation can be traced down to intersubjectivity and how we experience others, and he terms that political suffering. And it can also be traced back to our narrative selfhood and how we understand ourselves, and he terms that existential suffering. Interestingly, Svenaeus says in different kinds of illnesses, you get a mix of these different kinds of suffering. And so in non-life-threatening illnesses, particularly non-life-threatening somatic illnesses, let's say, for example, maybe like breaking an arm, he says that's predominantly alienation that's due to changes in embodiment, so illness suffering. But in terminal illnesses, like metastatic cancer, or psychiatric illnesses, like depression or schizophrenia, Svenaeus argues there's more of a mix of these different kinds of suffering. And he says the pre-intentional state and the alienation that's caused by it can be traced not just to changes in embodiment, but also changes in how we experience others in our world, and also changes in how we experience ourselves. And so for Svenaeus, psychiatric illness involves a mix of all these different kinds of suffering. And on the topic of psychiatric illnesses and psychopathology more broadly, phenomenology has also been applied to sort of understand these experiences. And the kind of questions phenomenologists ask themselves here is, well, how do the structures of consciousness change in experiences that we call mental illness? What happens to the properties of the window when we're mentally ill? And this field has quite a rich tradition dating back to the work of Karl Jaspers. And sort of, as we talked a bit about before, there's been lots of interesting work on schizophrenia spectrum disorders and changes in selfhood, and particularly the sort of minimal selfhood. There's also been quite a lot of work on mood disorders like depression, with the works of, for example, Thomas Fuchs, and him talking about changes in the experience of time or temporality with mood disorders. And for our purposes here, we'll talk a bit about the work of Matthew Ratcliffe. Ratcliffe's done a lot of work on the phenomenology of depression in particular. And so he asked himself, well, how do the structures of consciousness change in experiences that we call depression? And a bit like Svenaeus, he's immediately struck by the fact that there's quite a bit of variability in the kinds of experiences that become subsumed under diagnostic labels of depression. And a bit like Svenaeus again, Ratcliffe sort of becomes struck by the fact that when you look at all these different experiences that become subsumed under experiences of depression, we see that what seems to be involved in depression is a distinctive change in pre-intentional state. And when we sort of use synonyms for pre-intentional states like mood, perhaps becomes self-evident that depression and mood disorder does involve a change in mood. And so it's quite interesting here that sort of Ratcliffe sort of talks about this sort of shift in pre-intentional state in depression, and he characterizes the shift in pre-intentional state as one that's lacking in possibility. And to sort of make this a bit clear, my reading of Ratcliffe here is that, so let's say if we use the example of the book again, I can experience the book in many different ways. Normally, I can be conscious of it by perceiving it. I can be conscious of it by remembering it, by dreaming about it, by criticizing it and judging it or enjoying it. But under the depressed experience, under the experience of depression, the breadth of different ways I can be conscious of become narrowed. The sort of different intentionalities that we normally have access to sort of become restricted under the depressed pre-intentional state. And it's this narrowing in of the kinds of ways we can be conscious of the world and restriction of ways we can be conscious of the world, which Ratcliffe says underlie many sort of common sort of experiences that are found in depressed patients. He says it's this restriction in of the sort of pre-intentional state and the limitation of ways in which we can be conscious of the world that underlies the very excessive noomatic embodiment seen in depression. So often depressed patients will report that their bodies become very heavy and these very intrusive objects of their experience. Ratcliffe also argues that it's this underlying shift in pre-intentional state that underlies sort of kinds of changes we see in patients where their self-narratives become very past-focused and featuring hopeless futures. And so you see that there's this sort of narrative self that becomes involved here again. It's also the shift in pre-intentional state that Ratcliffe argues leads to this sort of pervasive sense of disconnectedness that's seen in patients with depression. And so what we see here is Ratcliffe, a bit like Svenaeus, finds a shift in pre-intentional state underlying sort of the depressed illness experience. And it's this change in pre-intentional state that Radcliffe argues manifests in our bodies becoming very noematically experienced, our narratives, and particularly our narrative selfhood, becoming restrictedly and past-focused, and our intersubjectivity and experiences of others becoming experienced in a very disconnected way. Okay, and so we've talked a bit about what phenomenology is, some of its key concepts. We've then looked at how it's been applied, and particularly we saw that with Linnaeus, phenomenology was applied to the study of the experience of illness, and how illness could be understood as a distinctive change in pre-intentional state that leads to the kinds of intentionality we have access to, leading to unhomelikeness and alienation from our existence. We also then saw Radcliffe arguing that depression involves also a change in pre-intentional state that can be characterized as a loss of pre-intentional possibility, where the kinds of ways where we are able to be conscious of the world become restricted to the point that we see these shifts in kinds of experiences of our body, ourself, and others. So let's talk about psychedelics now. What's been said, and how has phenomenology been applied to understand the psychedelic experience thus far? So I guess the question here is, how do the structures of consciousness change during psychedelic experiences? What happens to the properties of the window when under the influence of psychedelics? Or what is it like to look through a psychedelically altered window? An important note here is that to date, there's been, and there continues to be a high volume of particularly little p phenomenology work that's been going on in this space. And it's very fascinating work and very rich work. For example, there's been lots of very interesting work done on the sort of phenomenology of entity encounters under the influence of DMT. There's been some very fascinating work there. There's been less so capital P phenomenology work to date, although there is a sort of building literature that sort of does discuss sort of a capital P phenomenology of the psychedelic experience. Some of the existing work in this space has been done by a group over in Hungary with a sort of psychoanalytic background. That's been Savo, Horvath, and Summer. And Savo, Horvath, and Summer wrote a series of 3 papers that analyzed the ayahuasca experience, and particularly used the phenomenology of Maurice Merleau-Ponty to analyze the sort of capital P phenomenology of the ayahuasca experience. Now, one of the things they note in their analysis is that ayahuasca visions seem to involve a fundamental shift in embodiment, and in particular, a fundamental shift in noetic feeling, or the lived body. Another thing they note is that ayahuasca visions seem to represent a very unique kind of intentionality, but a kind of intentionality that has similarities to that of the intentionality of fantasy described by Maurice Merleau-Ponty. And so they do some very interesting work, sort of comparing and contrasting the phenomenology of and the intentionality of fantasy with the intentionality of ayahuasca visions. Another sort of great series of phenomenological investigations that's been done is by Benny Shannon. Benny Shannon's written a book on the phenomenology of the ayahuasca experience. It's a bit of a mix of capital P and little p phenomenology work. Some of the very interesting capital P phenomenology work that Shannon does is on temporality. And particularly, Shannon sort of breaks down many different ways in which ayahuasca seems to sort of shift our experience of time. And then, of course, there's the drug-induced ego dissolution and the discussions that have revolved around that. And particularly, Dr. Lethby's work has involved sort of analyzing how drug-induced ego dissolution involves these changes, in particular, a loss of the minimal self, loss of the narrative self, and experiences of pervasive connectedness. Interestingly, we see that already there's some emerging sort of debates arising around the phenomenology of drug-induced ego dissolution, with some emerging phenomenological scholarship sort of criticizing or raising some sort of concerns about this idea that the minimal self could be lost, and suggesting alternative interpretations of drug-induced ego dissolution. So all this is to say that there is some emerging work, some capital P phenomenology work that's been analyzing the structures of consciousness and how they're involved in the psychedelic experience. We can see already that there's changes in embodiment that seem to be involved, changes in intentionality that seem to be involved, changes in temporality, changes in selfhood, and changes in intersubjectivity. It's perhaps not surprising that so many structures of consciousness seem to be involved in psychedelic experiences, as there's sort of quite dramatic changes in our sort of subjectivity induced by psychedelics. Now, it wouldn't be a presentation, of course, without talking about your own work at some point in here. And so myself and Associate Professor Christopher Jordans from the University of Sydney published a paper earlier this year sort of analyzing the phenomenology of the psychedelic experience and how it could inform some of the sort of causal mechanisms that underlie psychedelic-assisted psychotherapy. Now, in particular, we look back on some of the previous work that we just mentioned in the previous slide, and we note that there seems to be quite a few different changes involved in psychedelic phenomenology. There seems to be quite radical changes in many different structures of consciousness. And we argue, a bit like Radcliffe and a bit like Svinaeus, that all this can be explained by a fundamental underlying change in pre-intentional state. In particular, we argue that there seems to be a shift in pre-intentional state that's characterized by increased possibility or a broadened range of available intentional experiences. So using the book, again, as an example, whilst in ordinary waking consciousness, I can experience the book by perceiving it, by remembering it, by judging it, by fantasizing about it, by critiquing it. Under the influence of psychedelics, we argue that many different new ways of experiencing the book become open to us. We become able to intend the world in many ways that were previously not possible, may be lost from our experience. And so we argue that there's a general broadening of pre-intentional state that allows for many new ways of intentionalities to become available to us under the acute psychedelic experience. Now, we argue it's this fundamental shift in pre-intentional state that seems to underlie many of these changes we've sort of outlined in the previous slide. In particular, we argue it's the shift in pre-intentional state that seems to underlie the loss of the minimal self, the loss of the narrative self, and extreme connectedness with others and the world at large. We then go on to ask ourselves, well, look, this is all very interesting and all, but what's the utility of such an endeavor? Is there anything that such a phenomenological dissection of the acute psychedelic experience can provide in terms of understanding the clinical effects of psychedelic-assisted psychotherapy? And we argue, well, yes, there is a utility in a phenomenological dissection of the acute psychedelic experience, and namely, I guess, an important fact to mention here that's important to sort of take note of is that to date, the empirical literature suggests that for psychedelic-assisted psychotherapy, it's the therapeutic effects that seem to be produced in the sort of early clinical trials that are being done at the moment seem to sort of be mediated by the kinds of experiences patients have. And so that's to say that when patients have particular kinds of experiences, this predicts better therapeutic outcomes. And so in particular, we see lots of work here on the mystical-like experience and how patients who have mystical-like experiences seem to have better therapeutic outcomes in the long term than patients who don't have mystical-like experiences. And so we ask ourselves, well, given the therapeutic and causal importance of the acute psychedelic experience, what can we learn from phenomenological dissection of this acute psychedelic experience? And sort of, we're going to get a bit into the weeds here now, and just bear with me because we are sort of heading towards the end of our discussion on psychedelic phenomenology here. But Jordan and I argue that when we bring together all these different sort of phenomenological ideas of illness, depression, and psychedelic experiences, we argue that psychedelic-assisted psychotherapy ameliorates unhomelike being in the world, which was Svinaeus' definition of illness, that is due to pre-intentional loss of possibility, that was Radcliffe's definition of depression, by inducing a broadened pre-intentional state characterized by increased possibilities. So that was our sort of phenomenology of the acute psychedelic experience. And so just stepping through this a bit more, when we looked at the phenomenology of Svinaeus and his phenomenology of illness, we saw that there was a pre-intentional change of unhomelikeness. And when you trace that unhomelikeness back to our embodiment, he termed that illness suffering. When you traced it back to our intersubjectivity and social engagement, he termed that political suffering. And when you trace that back to our self-narratives, he termed that existential suffering. We then looked at Radcliffe's phenomenology of depression and how, according to Radcliffe, in depression, there seems to be this pre-intentional loss of possibility that leads to changes in our embodiment, namely our body becoming excessively noematically experienced as this intrusive object of our experience. It leads to our social engagements feeling very disconnected and experiencing others in this pervasively disconnected way. And it leads to self-narratives that are very self-restrictive and past-focused. So immediately we see, when we look at these two sort of accounts of depression and illness, that depression involves each of the different kinds of suffering outlined by Svenæus. Illness suffering is manifested by excessive noematic embodiment. Political suffering is manifested by disconnectedness, and existential suffering is manifested by restricted self-narratives. And this is all to say that given in depression, the sources of suffering seem to be due in the depressed experience due to sort of different kinds of experiences and alterations, and particular kinds of alterations in our structures of consciousness, namely changes in embodiment, social engagements, and self-narratives. It would suggest that when attempting to treat depression, changes in these different structures of consciousness and addressing each of these different structures of consciousness might prove therapeutic. And so when we look at the phenomenology of psychedelics that we outlined, we sort of saw that there's a pre-intentional shift manifested by increased impossibility. And we argued that this leads to this excessive noetic embodiment, or the loss of the minimal self that we argued. And so experiencing not our body as an object of awareness, but experiencing the world that's manifested purely through our body. We also saw that the sort of phenomenology of the acute psychedelic experience manifests with this sense of extreme unity and connectedness with the world, and also this loss of our self-narratives. An important thing to note here is that the loss of the self-narratives has been found to sort of lead to increased malleability of our self-narratives afterwards, which leads us to be able to build our self-narratives in a way that's therapeutic. And so when we then look here at the structures of consciousness and how they're involved in psychedelic experiences, and we compare that with how the structures of consciousness are involved in depressed experiences, something seems to strike us a little bit. Or at least that's what Christopher Jordan and I thought when we sort of had a look at this. We saw, well, it looks like many of the changes that seem to happen in embodiment, in our intersubjectivity, and our self-narratives that happen under the influence of psychedelics almost seem to be antidotal to those that are seen in depression. Noematic embodiment of depression seems to be counteracted by noetic embodiment of psychedelic experiences. Disconnectedness and our intersubjectivity seems to be counteracted by extreme connectedness manifested. And our self-narratives seem to go from being this very restricted, sort of past-focused self-narratives that are seen in depression to being completely obliterated and rebuilt in perhaps more therapeutic and productive ways. And all this is to say is that a phenomenological dissection of the acute psychedelic experience is perhaps useful beyond sort of philosophical interest, and that there's actually some causal and therapeutic insights to be gained from a phenomenological dissection. And that was kind of the proof of concept work that Jordan and I were attempting to do in our paper here with this sort of table outlined above. Okay, so where does this lead things moving forward? As we've seen, phenomenology sort of involves this application of the structure, or this investigation of the structures of consciousness, and looking at how they've been applied in different areas. What might be next for the field of psychedelic phenomenology? Here, I think it's important to note that I think what might be coming next, and what maybe already is coming next, and if not, what should be, I guess, facilitated underway, at least in my eyes, is a bit more of a structured phenomenological research program. And namely, a bit more of a structured phenomenological research program that really goes in and systematically investigates how the structures of consciousness are changed during the acute psychedelic experience. How is selfhood involved in the acute psychedelic experience? How has temporality changed? How has embodiment changed? Really going through and systematically characterizing how each of the different structures of consciousness are changed seems to be a very important next step for the field of psychedelic phenomenology. And in particular, for this to happen, we need a lot more phenomenologically guided qualitative data. And so there is some sort of emerging works and calls for this to happen. And particularly, the intersections between qualitative research and phenomenology are quite interesting in themselves, although we don't have time, at least now, to sort of go into that a bit more. But what really needs to come next is sort of in-depth discussions and analyses of the lived experience of the acute psychedelic experience. And such an investigation is useful and interesting for several reasons. One of the reasons, at least I believe, such an investigation will be incredibly useful is that it leads to causal insights as to how the acute psychedelic experience might be exerting therapeutic benefit in psychedelic-assisted psychotherapy. So we touched a bit on it in the previous slide, but comparing how the structures of consciousness are altered in the acute psychedelic experience to how they're already altered in various psychopathological conditions that are being treated with psychedelics might give us very sort of novel insights as to how different kinds of psychedelic experiences might be more or less therapeutic for different kinds of illnesses. And so really systematically comparing and contrasting how the structures of consciousness are sort of altered with the acute psychedelic experience to different kinds of illnesses could provide sort of very interesting causal insights for psychedelic-assisted psychotherapy. I guess another way in which a sort of more detailed sort of capital P phenomenological investigation of the structures of consciousness in phenomenology could be useful is in developing sort of novel philosophical insights. I guess one thing to note at this point is that much of the knowledge we have around different structures of consciousness, such as selfhood or temporality, has come from investigating instances in which they've been altered. Particularly mental illnesses has been one of the great sources of insight into the structures of consciousness. A bit like a lesion-based model of investigation in the sort of neurobiological sciences, investigating what happens to things when they're altered gives us insights into how they are when they're not altered. And so investigating the way in which the structures of consciousness have been altered under the influence of the acute psychedelic experience might provide us with very novel and unseen insights into how the nature of the structures of consciousness themselves. And so we're already starting to see some of that work emerge with debates arising with sort of drug-induced ego dissolution and how selfhood can be understood to be involved. Is it a loss of minimal selfhood? Is it even possible to lose minimal selfhood? All these kind of very interesting discussions are already starting to emerge around sort of the acute psychedelic experience and phenomenology. And so that brings me to the end of the talk here today. Thank you for bearing with me. I know we got into the weeds there at the end. And I don't know if you've noticed, I'm a bit of a fan of various arts that reflect the phenomenological project. One of the, I think, most fantastic pieces of art that I've come across that sort of really reflects the phenomenological project has been Ludovico Einaudi's latest series of albums entitled 7 Days Walking. It's a series of 7 albums with the same songs, but each with slightly different variations. And it sort of reflects his path through the Alps that he has in his cabin that he lives there, and the different kinds of experience of his walk that he had on the 7 days he went walking there. And so each album reflects the same environment, but experienced in a different way. And so I'd highly recommend it for those that are interested. But yeah, so that brings me to the end of the talk there today. Here are the references for those that are interested, and would really love to hear sort of if anyone has any thoughts.